Welcome back, friends. Welcome back in another video tutorial in my YouTube channel. So this is a video of our tetanus lecture series. So up to previous video we have discussed about how tetanus plasmin do his job fantastically, right? So now it's time to classify tetanus. Okay, so the first and the most common type of tetanus is generalized tetanus. Okay, this generalized tetanus starts when spasm occur in the lower jaw of facial muscles. Okay, so now it is important to know about what is spasm. So you know what, spasm is nothing but sudden, very powerful and long lasting and very painful contraction of the muscle. Okay, I think you may remember that during the explanation of tetanus plasmin I have told you that it prevents the inhibition of the muscle contraction, right? And that is the reason of the spasm, because spasm is nothing but very powerful, sudden, long lasting and painful contraction of the muscle, right? Why it is sudden and very long lasting? Because here there are no inhibitory controls, right? And this contraction are too much powerful and too much painful that it causes bone fractures and muscle tears. Okay, and from the lower jaw of the facial muscles it can transfer to rest of the body. Okay, so that is the generalized tetanus. Okay, so in generalized tetanus spasms occur, and this spasm mainly occur in the lower jaw of the facial muscle. Now what is spasm? Spasm is nothing but sudden, very powerful, long lasting contraction of the muscle. Okay, and this muscle contraction causes or creates muscle tears or bone fractures. Okay, so now it is time to know about, so this is the lower jaw of the skeletal muscle, lower jaw of the facial muscles, right? That causes spasm. Okay, and from that part spasm is spread through rest of the part of our body and causes various complications that we will going to discuss today. Okay, so the generalized symptoms of generalized tetanus are divided into three parts. These three parts are together called Titanic Triad. Okay, so the picture that I have showed you is the first one of the Titanic Triad, that is trismus. Okay, that is the spasm of the lower jaw of the facial muscle, and here the spasm is mild to severe. Okay, and from due to this kind of spasm in facial muscle, a abnormal looking sustained green will appear. Okay, so what kind of thing it is? So abnormal sustained green means a abnormal type of smile. Okay, that is the thing that the picture shows. This abnormal type of appearance of the face is known as Rhiza sardonicus or Sardinian green, and that is nothing but due to the spasm of the lower jaw of the facial muscle. Okay, and after that when it starts to spread through the rest of the body it causes opisthotonus. Okay, this opisthotonus condition is the characteristics of the tetanus infection. Okay, remember it, where there are spasm in all the muscles of the body simultaneously. Okay, resulting in a highly arched back and patient resting in its heels and back of the head. So what is it will look like? So that is the condition of opisthotonus. Okay, as you can see, highly arched back and patient resting in its heads and in its heels. Okay, so much dangerous condition it is, as you can see. So that is the thing about generalized tetanus. Okay, so generalized tetanus starts with the spasm in the lower jaw of the facial muscles, and from that spasm will spread to the rest of the body. Okay, Due to the spasm in the lower jaw of the facial muscle, it facilitates rhizus sardonicus or Sardinian grin, which is an abnormal looking grin in the face, and when it is spread to the rest of the body, it ultimately causes the opisthotonus, which is the characteristics of the tetanus infection. Okay, where we are having spasms simultaneously. Okay, and as a result, the patients have highly arched back and they are resting on their heels and the back of the head. So now after this, there is a important information that tetanus not causes spasm in each and every muscle. Okay, it causes spasm only in skeletal muscle. That means the cardiac muscle and the smooth muscles are working properly. And along with that, there are some sympathetic overactivity that you may observe in a person suffering with generalized tetanus, because remember, try to observe the situation. Okay, so under such situation, it will be very difficult for us to swelling. Okay, not only that, there should be excess sweating under such condition, right? Because look, the patient is only helping himself with the help of its hands, right? So it is a heavier difficult thing, right? And that is why there should be excessive heating, excessive sweating. Okay, along with under such circumstances, it is also expected that drooling will occur. Okay, and the patient should have difficulties in urination, right? So such kind of extra situation are called sympathetic overactivity. Okay, this includes drooling, excessive sweating, fever, difficulty swallowing, breathing problems, irregular urination and defecation. Okay, so that is all about the generalized tetanus, which is the most common form of the tetanus. Okay, first spasm will occur in the lower jaw of the facial muscle. Okay, and from that it will spread to rest of the body. Okay, and due to the spasm in lower jaw, it facilitates trismus along with rhizus Sardinian grin, right, or rhizus sardonicus you can say, which is a abnormal looking grin. Okay, and from that it will spread to rest of the body, right? And when it's successfully reached each and every part of the body, it causes opisthotonus, where spasm occurs in each and every muscles. Okay, and as a result, patients have highly reached arc back, and patients are resting on their heels and back of the head. Okay, and tetanus is only occurring in skeletal muscle, that means smooth muscles and cardiac muscle will occur properly. And due to this kind of unusual situation, there should be some symptoms extra in that include drooling, excessive sweating, fever, difficulty swallowing, breathing problems and irregular urination and defecation. And this kind of symptoms are together called sympathetic overactivity. Okay, now it's time for localized tetanus. Okay, and it is quite rarer from form of the tetanus as compared to our generalized tetanus. Okay, here you will have persistent spasm only around the area of infection. Okay, that means here the spasm will be localized, and that is why the term localized tetanus or local tetanus. Okay, and this condition persists for few months and eventually subside with less than 1% mortality rate. So that is all about the local tetanus or localized tetanus, which is a rarer form of the tetanus where persistent spasm will occur only around the area of infection, and here the condition persists for a few months but will eventually subside, okay, with less than 1% mortality rate. More rarer form is the cephalic tetanus, which will only occur to muscles which is supplied by 12 cranial nerves. Okay, it is mainly occur due to head traumas, let's say for skull fractures, eye injuries, middle ear infection, along with sometime even in tooth extraction, and it is the ability to cause most deaths. Okay, so up to that part we have learnt about the generalized tetanus, which include spasm in the lower jaw of the facial muscle, and which in turn causes rhizus sardonicus or Sardinian grin and trismus, and from that the spasm is spread to the rest of the part of the body and facilitates the opisthotonous situation, which includes a highly arched back, right? And this kind of tetanus also have some extra symptoms, for example drooling, difficulty swallowing, excessive heating, fever, etc. And this kind of the extra symptoms are collectively called sympathetic overactivity. Okay, and this is all about generalized tetanus. Then we have discussed about localized tetanus. Localized tetanus is nothing but the persistent spasm which will only occur around the area of infection. Okay, that is why the term localized tetanus, and this kind of condition will persist for few months and eventually subside with less than 1% mortality rate. Okay, but most dangerous form of the tetanus is cephalic tetanus. Okay, and it can only limited to muscles supplied from 12 cranial nerves. Okay, yes, and this can help in the case of head traumas, for example skull fractures, eye injuries and middle ear infection, and sometimes even in tooth extraction, and it more likely to cause death. Okay, and the last one is neonatal tetanus. Okay, if the newborn's mother is not immunized, the newborn can develop neonatal tetanus. Okay, or if the umbilical cord is cut with a non-sterile instrument, under such circumstances it will become very dangerous for the newborn, because newborn can develop a highly lethal neonatal tetanus. But luckily nowadays most of the mothers are immunized by themselves, and as a result newborns are getting passive immunity against to fight against those neonatal tetanus causing Clostridium tetanus. Okay, not only that, even in developing countries nowadays hygiene standards have been improved, and as a result even in developing countries also now we are using properly sterilized instrument to cut the umbilical cord. Okay, and that is why the chance of neonatal tetanus is minimized nowadays. So that is the 4 common type of tetanus. Okay, first one is generalized tetanus, which causes spasm first in the lower jaw of the facial muscle, from that it will transferring to rest of the body. Okay, spasm in the lower jaw of the facial muscles causes trismus along with rhizus sardonicus or Sardinian grin. Okay, and from that they will facilitate the condition called opisthotonus, right, by spreading through rest of the part of the body, right. And then after that we have learnt about the localized tetanus. Localized tetanus, as its name suggests, it involves persistent tetanus which only confined around the area of infection. Okay, and the mortality rate for localized tetanus is less than 1%. Okay, but the dangerous one is the cephalic tetanus, which is only limited to muscles supplied from 12 cranial nerves. Okay, and it is mainly occur due to head traumas such as skull fractures, such as eye injuries, such as middle ear infection, and such as sometime when such kind of tooth extraction also. Okay, and it is the most lethal type of the tetanus with having a high mortality rate, right. And the last one is the neonatal tetanus, which may occur if the mother of the newborn is not immunized, and if the umbilical cord is cut with non-sterile instrument. Okay, under such circumstances neonatal tetanus can occur, but luckily now most of the mothers are immunized, and not only that, in developing countries also we are using a properly sterilized instrument for cutting the umbilical cord. Due to the improvement of hygiene standards, it is very good news that neonatal tetanus is minimized nowadays. Okay, so that's all for today. So today we have discussed about the various form of tetanus. So we will again come back with another video where we will talk about the diagnosis of the tetanus. Okay, so till then, bye bye, take care.